Dr. Vince Akimoto on the line here. I think he's there. Doc, is that you?
That'd be me.
Okay.
You guys are having too much fun. I think it'd be better if you just keep talking because, unfortunately, there's too much bad news going on in the world today.
Right, but that felt kind of weird to talk about playing jacks at a time like this. But I think we do need kind of those lighter moments just to handle everything that's going on.
No, and I think it's appropriate. It's important, and I'm glad you guys are on the air. I know this is difficult. You guys are you're like the island's therapist right now because everybody just needs to know that things are going to be okay and that there are people out there looking out for us. You guys are the eyes and the ears and now the mouth of Guam. But I'm really glad you're able to let the people of Guam speak too. And let me speak quickly so I can get out of the way. Did you know that those bottles that the kids like to carry around, their water in, it keeps things cold. It became really popular.
The flask, the hydro flask.
Yeah, did you know those are made in China? You might want to put those down now. No, just kidding. But the Wuhan Chinese virus is here, and it's at GMH, and we're trying our best to make sure that the people who get it get out, that they're cured from it, and it looks like there are people that had some pretty severe disease and that they've rebounded. So there should be some really beautiful stories coming out of how well these people were taken care of at GMH, how heroic the nurses and the doctors have been, the infection control people, the guys who take care of the air quality, because that's essential. This is an aerosolized airborne disease, so we need to make sure that everything that keeps the air circulating the right way, which is away from the other patients, is working. The plumbing, the electrical folks, the guys who just keep that place sterile and clean. GMH has to be the best it's ever been because it is now Guam's pandemic hospital, the coronavirus hospital. And so we're very, very hopeful that GMH will rise to the challenge.
Right. I'm still trying to figure out how GRMC got off without, getting COVID. I mean, they must have got some pull. I mean, we're putting all our COVID people over at the Brokedown Hospital.
Okay.
It's crazy.
Okay.
Well, so that's the reason for the call, actually. So a very, very good question. And the answer is, we need a clean hospital and we need a dirty hospital. I think Sabrina was going to say that. And it shouldn't be say dirty, but it's coronavirus hospital, where the people who are sick are going to be. And the deal today, though, is that despite whatever curves are coming out of whatever statistics are coming out of public health, no one in their right mind should believe that somehow Guam has avoided the fate of Italy, of New York City, of L.A.,
right.
Washington State.
Doc, we talked about this yesterday, and the reason why we're seeing these lower positive results is because they've changed the way they're testing people, who they're testing. They now are only doing what they're calling priority testing, which is limited to, I believe, 3 or 4 groups. I don't have the release in front of me, but basically it's anybody at GMH who is exhibiting COVID-19 symptoms, healthcare workers who are exhibiting COVID-19 symptoms, I believe elderly who are. So anyway, they're kind of changing the way they test people. And so what we're seeing is we're not getting those people like you maybe on the front line. Someone comes to you, hey, got a flu-like symptoms. They meet all the old criteria, but we found out yesterday from Dr. Cabrera that if Dr. Vince Akimoto swabs a patient at AMC or whatever clinic, that's just going to go in a room somewhere, sit on a shelf until public health finishes testing these priority groups.
Well, whatever the case may be, we have enough data to recognize that coronavirus is here and that we are on a very steep curve where the amount of cases that we're going to see is exponentially rising. It may double every day. Dr. Cabrera, I don't think, is minimizing the effect of this. In fact, he's very, very concerned. He's on the front line of this. There's a lot of people, and what I want the people to know before I say what I'm about to say is that this is something that your medical community is ready for. They're hungry to prove their competency, and they're putting their lives on the line. They're risking their own family's well-being to be there every day to take care of this problem, and they're confident and they're working round the clock. So this is a fight that we're itching to have because we plan to win, and we plan to do it in record time because we have the advantage of being the greatest community in the world. But the bad news is that since we've decided to make GMH the pandemic hospital, we must move the women and children first. We need to do it gracefully. We need to do it efficiently, but we need to do it today.
We need to do it yesterday, Doc.
Yeah.
Well, so yesterday it came and went, and I know that there's some resistance in the Guam Memorial Hospital administration, but this is not the time for us to start reminding them how incompetent they are. This is a time for us to rally to their side. And despite the fact that they couldn't fix the electrical panel, the roof, the elevator, we're somehow going to trust that they're not going to let this pandemic kill us all. But I'd rather not find out later, because these are unnecessary, innocent potential victims of what are called iatrogenic infections, which means you got it in the hospital because somebody didn't wash their hands.
Right.
So whenever you're in, sorry, yes.
Oh no, I was going to say it sounds like you're not buying the explanation from the hospital administrator during the press conference yesterday when she said there's so many details, so many moving parts.
No,
you've got
we solved our problems overnight. GRMC is ready to receive. They've been ready to receive for the last 4 days. They had an OB ward. They have everything, and it's cleaner, newer. I doubt that any mom or pediatric patient, any family that has to transfer from GMH to GRMC is going to be disappointed.
Right.
It's kind of like what they did with.
This is what we call a COVID-19 silver lining, Doctor.
It would be one like when you go and coach and you said economy and they both get the first class. So let's do this nicely. Let's not be backstabbing anybody or stabbing them in the face. The hospital is trying to do many things at one time. So let's do this for them. Let's have the moms, the grandmas, the aunties, anybody who's staying at home, got nothing to do. Please flood the GMH administration with your 2 cents worth, or call this station and let people know if you feel it's all right to leave your women and children in a pandemic hospital while they try to figure out if it's clean enough.
Doc, thank you.
Yeah. Okay. So have a nice day.
All right.
Thanks, Doc.
Wow, I love the way he just starts all positive, and it's like going to the doctor's office. They're like, hey, the good news is, man, yeah, you've been going to the gym, man. Bad news, ooh, boy, you're gonna die tomorrow. So what was the response? I mean, that was the question we made the ask yesterday in the press conference. What's the status